Good morning. So, Excellencies, ladies and gentlemen, adolescents and youths, researchers, policymakers, especially Professor Yamane, who played a critical role in the scientific push for the opening of our office, and friends from media, invited guests from different parts of Africa and the world. It's my honor to be here today to deliver the keynote address on the critical topic on bridging the gap, building partnership for sustainable research capacity building in adolescent health in Africa. World Health Organization, or WHO, usually classifies persons in the age range of 10 to 19 years as adolescent and 15 to 24 as a youth. While the adolescent classification is most of universal and different in continents or nations, they try to adapt those age groups. But the definition of the youth is also influenced by some constant change in demographic, economy, socio-cultural circumstances. Africa is the land of young, as we heard yesterday, especially the Sub-Saharan African countries with a median age of 20, and our country, Ethiopia, is also part of that. Adolescents or adolescents, especially early adolescence, is a period of rapid change, physically, emotionally, socially, and cognitive. Then that changes influence the adolescent thinking and their decisions. Before 4 years, the Sub-Saharan African countries have 250 million adolescents, which is nearly 20% of the worldwide, which is going to be expected to the 24% in 2030s, according to the population reference bureaus. And Ethiopia is part of that one. And because of this, Ethiopia has a national policy, especially the National Youth Policy, which adopts for the age of 15 to 29 years. From that one, our ministry has developed the strategic development for adult, youth, sexual and reproductive health, which we have been using from 2006 till now on the third round. The first one was the very good one, which aligns with the GTP one, and it was used for 5 years because of some of the challenges, because there was a lack of multi-sectoral collaboration, low stakeholders and youth involvement, and there was inadequate resource mobilization. So it was persistent, and we need to improve, and we try to see the second one, which was ended before 4 years, and we are on the fifth one. That's the third one, sorry. The second one was a bit good rather than the first one, because instead of addressing only HIV and some of the conditions, it tried to include nutrition, mental health, substance use, non-communicable disease, and intentional and unintentional injuries. But still, the second one has got some lack of emphasis on the early adolescence, lack of meaningful young engagement, and benefiting from innovations and technologies. So there was a gap on that one, and the third one was implemented, continuously working with consolidating the achievement of the recent one, the other one, and then they try to foster at least into the measurable effects. And it has got some targets, because that target has some impact on the adolescent health, because we need to get the mortality rate to be decreased. We need to get reduced pregnancy-related mortalities into the age groups to bring into 0.29, and to reduce some pregnancy-related mortality rates, reduce teenage pregnancies from 12.5 to 7. By using some of those measurable things, the third one is on action, and it's at the end of the last lap. So we are progressing for the other, which is going to be held very soon. The final one that we have is there is a lack of research and innovation on that area, especially on the primary causes of mortality, morbidity, awareness, fundamental social, behavioral, and cultural forces. So we are working on the new one, which is going to enhance the health literacy among adolescents and youths, which is going to improve more of equitable access for the adults and youth health service, improve quality of adolescent and youth health service, and we need to increase some of the accountability and youth and adolescent leadership mentoring. So if that was the policy of the strategic policy, in terms of some of the bridging in the gaps, there are a lot of challenges that we have seen. The first one is the demographic transitions. The demographic transition, which is going to drive most of the national wealth. So the country has to invest, educate, and employ their large number of young peoples. Even they have to protect them from unrest of the country instabilities, and they need to promote the gender equality and maintain their health. This disproportionality in the high health burden experienced by the adolescents in Africa reinforces some of the importance of the access for the comprehensive and affordable health services. So it is very important to understand these changes and their dynamic extensions. Then it is important to reduce the health risks and engaging young peoples during formative years that will shape the adulthood and future of the generation. So it is important to lay those crucial foundations, whether it could be positive outcome and successful transitions of the adulthoods. Then this idea has to be differentiate most of the gaps, and from that gap we have to understand how to improve the adolescent health and issues related to the other problems that we have seen earlier. So as we know, the adolescent health is a pressing issue in many African countries, with significant challenges around sexual and reproductive health, mental health, nutrition, and more. Yet, the research capacity to fully understand all the addressed problems is challenging and remains limited in much of the areas. To improve the adolescent health and research, because as we have mentioned earlier, adolescence is the critical period for the physical and cognitive and social emotional development, we need to see and change some of the key issues. The first one is there is a significant gap. Then we have to understand the importance of those gap, and we have to produce the good research with the scope, trends, and drives that adolescent health challenges across the continent. The second one is there is a lack of awareness uniformity that access even to as simple as the contraceptive and some of the STIs. The other problem that has seen is the mental health challenge, because there are depressions, anxieties, traumas, and there is still the double burden of nutrition, whether it could be under or over nutrition. And the other issue of the other gap is mentioned is the impact of poverty, gender norms, and other social determinants on the adolescent health. So the key research gaps on adolescent health in Africa is, the first one is lack of comprehensive data and surveillance system, and that is many countries, they don't have like national representative data on critical adolescent health indicators such as sexual, reproductive health, mental health, and nutrition, and in the expense of the violence. The second one is inadequate evidence on effective interventions, as we have mentioned earlier, because the research is limited on the programs, policies, strategies, are most effective at improving health outcomes in African countries or in the African context. So there is a particular dearth of evidence which needs some scalable, community-based interventions that address social determinants of adult health. The third gap is insufficient focus on the marginalized and vulnerable groups. Research often fails to inadequately capture the unique health needs, challenge faced by the marginalized adolescents, such as living in the poverty, with disabilities, or other forms of minorities. The fourth one is there is a disconnection between researcher and policy or practitioners. This is too often the research that is conducted does not directly inform the development and implementation of adolescent health policies and programs. And there is the mechanism for translating research into action and ensuring the response to community needs are underdeveloped. The fifth one is there is a limited research capacity and infrastructures, which mentioned earlier. Many African countries, they have lack of research facilities, equipment, data systems, and the skilled person, which require to conduct high quality studies on adolescents' health. And the issue of brain drain, limited research fund, and weak institutional supports are also other problems. The sixth one is there is a neglect of key thematic areas. Because in certain adolescent health policies, especially on the mental health, nutrition, and some of the impacts of social determinants, they are relatively unexplored in African countries and Sub-Saharan African countries. So there are limited evidence, and intersections between different adolescent issues is also another gap. So addressing those critical gaps will require some of the multi-sectoral or multi-stakeholder effort to build minimum of the sustainable, locally driven research capacities. So, in order to tackle those things, the first thing is we need to build sustainable research capacity by addressing those knowledge gaps. By strengthening research infrastructure and systems, we need to invest on the research facilities, equipments, and data management system, even in publishing reform or platforms. The other issue is collaboration with universities, research institutes, ministries or inter-ministries, and other key stakeholders which are going to align with the proper priorities and coordinating office. Parallelly, it is important to think about the securing long-term funding commitments from diverse sources like government, foundations, and other private sectors. The second one is training on the next generation Africa researchers. If we need to invest in training of the next generation, supporting degree program as mentioned earlier, postdoctoral fellowship, mentorship, and providing opportunities on research or research experience and skill buildings are also important. The third is fostering multi-sectoral partnerships, engaging policymakers, communities, community organizations, young peoples as a research partner is also important of fostering multi-sectoral partnership, and facilitating south-to-south or north-to-south collaboration in knowledge sharing, and ensuring research in responsive to the community is also important during the capacity building. Having said this, the way forward has to be, there are a challenge, and those challenges could not be like a simple task or an easy task, but I am still optimistic by working together across disciplines, sectors, and borders, we can build sustainable research capacity needs to transform adolescent health outcomes in Africa. It will require long-term flexible funding, political willing and commitment from governments, and through partnership and cooperation with young people themselves are also important. And there are both possible imperative if we can unlock most of the potentials, and working with the critical population is also important to as a way forward. The other issue is convincing the policymakers to invest on the adolescent health research can unlock some tremendous potentials. Healthy, educated, and empowered young people are powerful engine for social and economic development. They can robust some of local research capacities, essential in identifying context-specific needs and develop tailored solutions. Finally, strengthening local research capacity and foundations to improve adolescent health outcome across Africa by working together in true partnership is important. Let us live here today, energized ourselves, ready to roll up our sleeves, and I'm confident we can build future where all young people can thrive. The future health and well-being of African adolescents and young depend on all of us. I thank you.